Hello friends, Justin Brock with Bobby Brock Insurance here, and in this video I'm going to dive deeply into Medicare Part A, so stay tuned. So Medicare Part A, if you watched our Parts and Plans video earlier, then you probably know a little bit about it, but we really want to get into each of these individual parts in a separate video so we can fully understand what they entail. Part A of Medicare, again, is for hospitalization, that's inpatient hospital care, skilled nursing facilities, home health care to some extent, or hospice care, and hospice care. All of those services are covered under Part A. But what is your responsibility if you don't have a supplement or a Medigap plan or a Medicare Advantage plan? With Medicare, there are tons of numbers thrown out there, and so it's hard to get them all right all the time. But I'm going to go over this one time, and I'm going to use a quick reference just to show you that these numbers are completely accurate. Most carriers that offer Medicare supplements or Medicare Advantage plans will have some sort of outline of coverage or book that will show you the exact amounts that you can be out of pocket. You could also find it in your Medicare and You handbook if you have received that. So the first one I'll look at is Medicare Part A's hospitalization coverage. If you're hospitalized and you have Medicare Part A, and we're not going to talk about having a supplement or anything like that, if you just had Medicare Part A for this hospitalization, in the first 60 days, you would just pay your inpatient admission deductible, which is $1,364. Now remember, this video is being recorded in 2019, so if you're watching it in 2020, it could be slightly higher because these numbers can change year to year. Days 61 through 90 in the hospital, you would start picking up a daily copay starting at $341 per day. And after day 90, at 91 and thereafter, you would have $682 to pay. If you're not on a Medicare supplement plan, you would have 60 lifetime reserve days at the $682 per day. Later on in another video, we'll talk about lifetime reserve days, but that's a typical long-term hospitalization stay. Now, if during that hospitalization you were moved to a skilled nursing facility or rehab center or sling bed, as some people know it, during the first 20 days, you would actually pay nothing for that skilled nursing facility or rehabilitation stay. But days 21 through 100, you would pay $170.50 per day under Part A. Days 101 on are not covered by Medicare. Most of the time after an extended skilled nursing facility stay, if hospitalization or full-time treatment is still needed, they will readmit you to the hospital. But that's always up to the hospital director and your insurance company to work out. On blood as a service under Part A, Medicare pays $0 on your first 3 pints. So your first 3 pints of blood you would have to pay for if you had no other supplement or any additional coverage. After the first 3 pints, Medicare Part A pays 100%. On hospice care, the original Medicare or Part A actually typically pays all of hospice care. So going back to recap, if you have Part A only for a hospital stay, and we're talking about basically the room and board, you would have the $1,364 admission deductible for the first 60 days of each stay. Then you would have a $341 copay for each day from day 61 through 90. And then during your lifetime reserve days, after day 90, you would have 60 days at $682 per day. Skilled nursing facility, first 20 days are covered. Days 21 through 100, it's $170.50 per day. And then again on blood, the first 3 pints are paid for completely by you, and then after the first 3 pints, the Medicare would then pay for the rest of the blood necessary. So that is kind of Part A in a nutshell. You can get more deep into it by finding out how often you might have to pay that hospital admission deductible. The good thing to know is you can get coverages with your Medicare Parts A and B to come in and fill the gaps called Medigap or Medicare Supplement Plan. You can also get a Medicare Advantage plan that can put some cost controls on there. So there are multiple options. The best way to find out about those options, as always, is to request information on our website or reach out to us directly at 662-844-3300. Thank you guys. Thank you so much for watching. I hope we can help you with something. If you want to stay tuned, we'll talk about Part B in the next video.